Good evening, Philippines. It's Wednesday, May 29, 2013. Welcome to General Assignment. On the show this evening is Health Assistant Secretary and the spokesperson for the DOH, Dr. Enrique Eric Tayag. Good morning, sir, and welcome to General Assignment.
Hello, Miguel.
Okay. Friends, I think that most of us will be welcoming the rainy season after such a long and scorching summer. But with the rainy season comes new problems, new issues. We're talking about waterborne diseases, and we have none other than Dr. Tayag, who will shed light on certain issues and certain concerns regarding diseases that are most prevalent during the rainy season. Dr. Tayag, I understand before anything that the Department of Health has launched a program to sort of meet head-on the cyclical nature, the cyclical problem of rainy season diseases. What is that?
The season diseases, we have given an acronym for them. It's WILD.
WILD.
W stands for waterborne diseases or diarrhea. I for influenza or other respiratory tract infections. L for leptospirosis, and D for dengue. So essentially, the program for prevention and control will be against these four major diseases.
Okay. Sir, we've always had the perception that with the rains come, the sniffles, the colds, the flu. Is there any scientific basis to the fact that there is the incidence of diseases really shoot up during the wet season?
First of all, the viruses, especially the influenza viruses, are spread from person to person. And during the rainy months, more people come in contact with each other in environments that make it easily for the virus to spread. The reason for this is that it coincides with the school opening. And so therefore, this is what we may call overcrowding, if you want to call it. Schools open.
School buses are crammed.
Yes, students are back from other countries, and so therefore they may carry the influenza virus. I remember during the H1N1 pandemic, students coming from the United States actually may have spread the influenza virus, the pandemic influenza virus, to other individuals here in the country. When that happens, though, it's easy to prevent and control. We always tell the public to observe hand hygiene. That means washing our hands, because it is in our hands that these viruses land. And as soon as we transfer these viruses to other hands, to other people, through indirect or direct contact, then people get sick. And when we sneeze or cough, then the virus particles are actually spread to other people.
The concerns over the H1N1, the SARS, and a lot of other communicable diseases has sort of changed our culture somewhat. No, before when I was younger, I could remember that in the public restrooms, in the malls, in the supermarkets, or in the restaurants, they only had soap in the CR, the comfort rooms. But now they have all the hand sanitizers, the alcohol. Do you think that this sort of this turnaround in how we view and how we prepare for communicable diseases, has this helped to put those diseases at bay?
It has helped up to a certain point, but these viruses are unpredictable in its nature. For example, the bird flu A87N9, now ravaging China, was not predicted to cause such serious illness. It was a new bird flu strain. it was not known to be pathogenic or cause serious illness in humans, but it did. Um, Only China, but outside of China, Taiwan has reported one case. We're watching it closely because the World Health Organization has already sounded an alert that it might spread, although at this time there are no indications there's person-to-person transmission.
So I guess in a way, all these diplomatic problems or brouhahas we've been having with mainland China and Taiwan may actually have a sort of a silver lining in that there are less people traveling between the two countries. So
Well, since there's no person-to-person transmission, the exposures to infected poultry is the only means at this time by which any individual can get infected and have the disease.
so this is not airborne yet. This has you have
It's
to
droplet. It's transmitted from
Sweat,
infected
saliva,
chickens to an individual, but there are no signs yet that an individual can spread it to another individual.
Okay. Before anything, Dr. Tayag, I understand that there was sort of a command conference of the line government agencies in preparation for Monday's opening of school year, the school year, no, yung pasukan, in other words, led by the Department of Education, and you represented the DOH. So, what were the strong points in the discussions that our viewers may want to know?
Oh, that's correct. Several agencies shared their program of activities when schools open on Monday, most of the schools, that is. For example, Pag-asa would give the weather forecast, and they said that for Metro Manila, at least on Monday, it's going to be sunshine. But
Which
for
means
the
it
whole
may
month,
rain.
yeah. But for the whole month of June, though, they are expecting 2 typhoons to hit the country, and it is the western part of the country which will have most of the rains, and so therefore, the Department of Health, which I represented in that meeting, would hasten to remind people that because of the rains, it also is the beginning of the dengue season, the influenza season, the 2 diseases I mentioned earlier. And when there are floods because of the rains, then we have problems with leptospirosis. And of course, when our drinking water sources are contaminated, we have the waterborne diseases or diarrhea.
So, in other words, you're really preparing for the full brunt of all these diseases concentrated within 2 or 3 months. No?
Not only diseases, but the health of students in general as well. For example, parents have been liberal during the summer vacation to have the children stay late at night. So they have a few days now to make sure they go back to their usual early sleeping patterns, so that even if they wake up very early, they have enough sleep the night before.
I think, Dr. Tayang, one of the major changes that has taken place in the past couple of years is the realization that the DepEd cannot decide the cancellation of classes for every locale, because every place, every barangay has its peculiar characteristics. No? I mean, the rains may not be particularly strong, pero kung bahain, like in Malabon or Navotas, the LGUs, the local government units, are being given the go signal to make the final decision in accordance to what they see in their
That's the way it is now. DepEd reiterated in that command conference that it's the local government who will be responsible for announcing suspension of classes due to extreme weather disturbances.
One problem I can see with that is it's a matter of communication. No? Before, when it was sort of centralized, they can announce it over the TV or the radio. But now with all these, with every LGU making their own judgment call, how do you see that
Well,
working?
the factors that may actually influence such announcements would be the time of day that the weather disturbance would be assessed as extreme, and so therefore would warrant suspension of classes. So if it happened, for example, on midday, it's too late for them to suspend classes. If it happens at night, then they have a lead time to announce suspension several hours before classes start. So it's affected by such conditions, and also the predictions of Pag-asa and the warning system that they've devised for floods. So they have color-coded this, for example. There's yellow, there's orange, there's red.
Okay, if you want to take part in our discussions, you can text us by way of 0915-209-6012. It's flashing in your screens right now. It's globe number 0915-209-6012 for your questions, your comments, your concerns, your health concerns. We're talking with Dr. Eric Tayag, spokesperson for the Department of Health. Sir, as far as the DOH is concerned, are you all systems go for Monday, for pasukan?
Yes, we are. In fact, we involve ourselves with the Brigada Escuela, Balik Escuela program of the DepEd. We wanted to dengue-proof schools. We wanted to make sure that all mosquito breeding sites are getting rid of, and we want to make sure, of course, that the schools will actually practice the 4 o'clock habit. Every 4 o'clock in the afternoon, someone or several have to go around the school surroundings and identify and destroy all mosquito breeding sites. So there's going to be a search operation every 4 o'clock in the afternoon.
Why 4 o'clock?
To make it a habit. Because we have the 3 o'clock when we pray.
Yes.
So an hour after that, 4 o'clock habit. We want to make it a habit. It could have been 9 o'clock, but 4 o'clock is just fine, because not only schools can participate, workplaces can participate, government offices, private offices can participate.
We have been hearing a lot about the dengue. No? I mean, before, a lot of the victims were young, were kids, but we're seeing more mature patients right now. We've all had friends, co-workers, or members of the family who have been affected by this disease as of late. Is this indicative of some sort of mutation in the strain?
No, we explain it by the immune resistance that an individual carries against a particular strain of dengue. It's possible that they may not been exposed to any of mosquito bites that infected mosquito bites when they were younger, and so therefore they remained susceptible as they grew older.
So you actually develop resistance to dengue?
If you are able to get infected 4 times, because one infection with a particular strain protects you only from that strain, but does not protect you from the other 3 strains.
So you have to get sick before you
yes, that's the only way our body can fight subsequent infections.
Okay, very interesting. Again, if you want to take part in our discussions, kindly text us by way of our hotline. Kindly text at least your first name and where you're from so we can gauge our reach. General assignment will be right back after a few reminders. Don't go away.